Hey guys, welcome to Herding Little Cows to the Glory of God. This is not our typical video. You'll notice that I'm in our room with the door closed because I wanted to just say some things that I didn't want to necessarily have all of our kids here. And so I'm going to talk about what's going on with Josiah right now. So I just ask that if you have family that normally watches the video, like you guys all as a family, I make our videos all so that they are proper for everybody. And everything I'm going to say in the video today is proper. There are just things that Josiah is a 9-year-old boy who wants to fit in with the other kids. And so some of the things I say might be something another child might make fun of him for. So I'm just going to preface that if you have kids that have a tendency to say things sometimes that maybe they shouldn't say because of something they heard, I have kids like this. They speak out of turn when they shouldn't say something. Just know that I'm going to be saying some things about Josiah that might be a little sensitive in nature, but nothing that a child couldn't hear. Just if you happen to know Josiah personally, he might be bothered by another child saying something to him. So anyway, today is Sunday the 15th, May 15th. So it was just a little less than 2 months ago that Josiah ended up in the hospital with his seizure that wouldn't stop. We ended up in the ICU in East Tennessee Children's Hospital. And they were great. They got the seizure to stop, but because of all the medication they had to give him, he had to be intubated for about 18 hours. We had to come out of that whole process. And in all of that, he was given a bunch of medication and we started a new medication. So currently, Josiah is on Keppra, which has another name, but Keppra is the most known, and Epidiolex, which is a FDA-approved CBD oil. So we've been on the CBD oil for a year, little over a year. We've been on the Keppra since the hospital. We felt it was in his best interest to try another medication because we don't know why that big seizure happened. Seizures are hard to decipher. So it's not, he ate too much sugar that day, so he had a seizure. It's kind of like blood sugar. Some people think blood sugar is all about the meal you ate beforehand. It has to do with how much you exercised, how much your body was sweating, how much you slept, and seizures are very much the same way. I can't tell you this is what brought it on. I might know some of his triggers. If he gets spooked, like, you know how kids like to jump out at each other and boo, that could send him into a seizure, but that's not the only reason he has seizures. So we can look back and say, well, maybe he was overtired. He had a slight fever when we got to the hospital, so maybe that was what started it, but we don't really know. So to be able to leave the hospital, to be able to do what was in the best interest of our child, to be able to try fighting this epilepsy, we put him on more medication. I don't know. Putting him on more medication was the right thing to do to see if it would help. I don't know if Keppra was the right choice. It is what it is. We had to do something. Because we were in Tennessee and traveling home, Keppra was the best choice. We had talked to our doctors about something. We were talking about starting new medication when we got back to Maine. Anyway, we were going to stay stable on the medication we were on before we went to Tennessee. And then possibly start something once we came back to Maine. We had to make a choice there at the hospital. The other medications that he would need to do all had risk factors. Keppra has risk factors also, but the other medications all had risk factors of things where we had to regularly check blood work, or there could be this life-threatening side effect that only bothers, like the one was you could get a life-threatening rash within a couple days of taking it, and we didn't want to be, again, away from home or on the road. or something like that, and have one of these life-threatening side effects. So the Keppra, while it does have side effects, wouldn't have a life-threatening side effect on our way home or need to be monitored more closely by the doctor. So we chose Keppra. That's what we chose. So that was 7 weeks ago. We chose the Keppra. We have not seen a reduction in seizure activity. We've actually seen more seizures since starting the Keppra, but starting the Keppra also was related to his big seizure that ended him at the hospital. So I'm not blaming all of the things that we're dealing with right now on the seizure medication. This might just be his new normal because his brain had a bad seizure. And while the seizures don't typically cause brain damage for him, some seizures, people will forget how to read or forget how to walk or those types of things. Once he actually recovers from the seizure, he's back to where he was the day before. We don't lose anything in the seizures typically. But because he had such a long seizure, it is possible that that seizure did have him lose ground on where we are. Or the extra seizures he's been having have started a new pattern of more seizures in his brain. So it very much could be seizure activity, and that's what the doctor wants me to think. But we have had more seizures, more tiredness, and more behavior issues. So when I say behavior issues, these aren't typical behavior issues that need to be disciplined for. He does need to be corrected. He does need to, I can't let him go about doing things that he shouldn't do. If you have a child who wants to break a window, it's not okay to just be like, oh, well, it's the medicine, so let him break windows. He has to be stopped from doing certain things. But the medicine has made him not Josiah. Talking to the doctor last week, she was saying that it could be the seizures that have caused the problem. It could be the medicine. But our next step through the doctors...
It could be a combination.
Yeah, it could be a combination of them. But the next step through the doctors is to get on such a dose of Keppra and Epidiolex that he would be stated to have intractable seizures. Mm-hmm. Is that what it's called?
Yes.
So seizures that are not helped by medication.
Because this is our third or fourth medication.
Yes, we've been on multiple medications, and what they say is when you get to 3 at the highest dose that your child can handle, which we've had a couple we haven't been able to handle, then it's said that you won't be helped by medicine. The options she gave are 2 types of surgery or a keto diet, but she told me you can't do a keto diet because you got a big family. If anyone could do the keto diet, Sarah, it would be you, but you can't do it. That's what she said. And she said that a medical keto diet is the child drinks heavy cream, eats bacon, and has a couple macadamia nuts once in a while because they have selenium in them. I think she needs a little more knowledge on what goes on in a keto diet. Even a medically induced keto diet, is that what you call it? Yeah. You have more options than just those things. It is very strict, and it's 90% fat, but it is more options than that. I feel like we could handle a keto diet, but with things we've tried in the past, research we've done, I don't feel that it's going to work for Josiah. I don't think it's because I can't do it, because we have done diet changes. We are right now on a diet for him, and we are sticking to it strongly, and he's not asking 100%. For other things. Yeah. He's not trying to sneak food or anything like that. So I feel if I felt a keto diet was actually going to help him, I feel we could do it. But I don't think that that's the thing that's going to happen. They also want to send us to Boston Children's Hospital to get a workup to figure out if he's a candidate for surgery. So the 2 surgeries, both brain surgery. One would cut out the part of the brain that is having seizures. And again, this would be a workup to have him go do get inpatient testing where we'd have to be in the hospital for a while for him to get all these things done. So decide whether they should cut out the part of the brain that's causing the seizures or put in a VNS, vagal nerve simulator. I don't know that is the plan. I know some people who have this for their children, and if you're watching my videos, I'm specifically thinking of my friend down in Texas whose little one has this. I'm not saying that it was a wrong choice for your family. For our family, I don't feel it's going to help Josiah with his type of seizures. And if you are a parent who has a child with seizures, you know how different each seizure is and why, because of what they're caused can make a difference in how the seizures are treated and all of that stuff. So again, I am not saying to any parent who has made that choice for their child that that's the wrong choice, but for us, that's not the route that we are pursuing right now. Because I don't feel that it's going to help to the degree that they think it would help.
They don't even know if it would help at all. They're just saying there's not many more options.
Right.
What they're saying.
Right. So we do not want to pursue that right now. But all of that to say, we had our meeting with the doctor on Monday, and she wanted to up the dosage so we could decide whether his seizures could be helped by medication. This was kind of our last ditch effort. And she told me, and so the therapy program we work with has told me that each different doctor has a different toolbox. And she told me her tool is medicine. That's what she has. And when the medicine doesn't work, she sends me to another person. And the next person she's going to send me to, their tool is surgery. And so they're either going to say, yes, we can help you by cutting his brain open, or no, we can't help you because our only tool is surgery. I am trying to go through the Family Hope Center which is the therapy place, and I've done other videos on them, but they use a much wider toolbox. So I'm not saying they don't have surgery as their option of fixing the brain, but they don't have just a hammer. They use a hammer and a screwdriver and nails and screws and all of those. And if we need to get out the sanding belt, we'll do that as a last ditch effort. I know none of those work together. But that would be, we're going to try all these other tools before we get there. And with our doctor, we have one tool. We have multiples of that one tool. We've got the big hammer. We got the small hammer. We've got the clawfoot hammer. I don't even know what they're called. But that's the only thing we have, is we just have hammers. And so we're working with the Family Hope Center with a wide variety of tools. But the problem is their wide variety of tools are not instant relief, especially for a child who's already on medication that's making his brain fried a lot of the time. So I hear the kids saying hi to Grandma in the other room. So for those who don't know, my mom lives in a little house in the backyard, and she comes up regularly. So she just walks in. So anyway, on Monday, we decided with the doctor that we were going to go up to show that the medication was not working, because Mark and I feel that the medication has caused problems, but we also don't want to give up too soon and later say, if we had just gone one more week, would that have helped? If we had, we're trying everything to the full extent that we feel is safe.
Well, to be clear, we are seeing 0 seizure reduction.
Yes, I feel like we are having
increase in seizures,
yeah.
And we're having serious side effects that we're not talking specifically about.
So we have severe behavioral effects, which mean Mark or I end up out of the room with Josiah for sometimes multiple hours a day, which has increased since we went up in the medicine, because it is the safest place for him to be apart from the family. I'll just say it that way. There's a turkey out in the neighbor's yard. So we also have had a child who is on the couch more of the day than he's off. And if you know Josiah, he's always moving around. He's always doing things. He's always very active. And he's not right now. So he's not our typical child. So
he's not reading. He's not learning.
Yeah. No, we have probably not learned anything since we've been on this medication, because he can't learn a new concept. He didn't lose his reading skills, but he can't comprehend enough to learn a new topic. He can't follow a conversation. He really wants to be apart from the family. Like, he says things sound too loud, and if you've been in our house, we have lots of kids, they can be loud, but because of Mark's neurological things and Josiah's, we have times where, okay, everyone needs to quiet down, we're all going to do this, and that even can be overstimulating to him. So not so that we can make our house loud again, but because Josiah needs to be able to function and not just be on the couch drugged all the time. We will be reporting back to the doctor tomorrow. The plan was to see if this medication helped and to reduce the medication gradually if it wasn't working, because we don't want Josiah to stay on a medication that's doing 0 to help his seizures. So we have, there's now 2 turkeys over there. So we now have, we're going to be doing a reduction in his medication. We still have his emergency meds available. We still have access to our doctors and all of that stuff. In the meantime, we're working on our therapy stuff from the Family Hope Center, but this past week we really haven't been able to do therapies or anything because Josiah has too many issues. Between the behavior issues and just being too tired, we haven't been able to get in a full day of therapy. We haven't been able to, we've been doing the diet, but even if we were doing it exactly 100% as they wanted to, I don't feel like we'd even see a change in Josiah because the Keppra is causing too much of a problem. And I feel the Epidiolex is too, but we've been on that one longer, so we're going to reduce Keppra first. So that's what's going on with our family right now. So you can be praying for us, for Mark and I, to have patience and endurance with Josiah as we go through this, because a lot of these issues are not Josiah. A lot of the issues are the medicine. But when you're having to deal with the issues, it can be very hard because it's not your child you're dealing with. The Family Hope Center talks about this action isn't your child. This is their brain. It's their brain misfiring. It's their brain on fire. It's their whatever. But it's not our child. So
we never understood that before.
Yeah, when we took the class actually like a year and a half ago, they were talking about, when your child says that they hate you and they don't want to do this and you just say, no, this is what we have to do for therapy and blah, blah, blah. And we were like, whose kid is that? Like, not that we doubted what he was saying, but we were like, that's not our kid. That's, he was talking about like every parent dealt with that. And this year we're like, oh yeah, we definitely are dealing with that. So, just patience and endurance as we deal with the drug, not Josiah. And for anyone who was watching earlier today, watching our Facebook page, it said that I was dealing with some stuff. I would call them migraines. I don't know. I haven't been diagnosed, but they're only every couple months. Just bother me for one day, but they knock me out. So this morning I got up, we were going to head off to church, and I was incapable of functioning. I just wanted to curl up in a ball and close my eyes. And so my family let me sleep for 3 hours. I woke up feeling slightly better and was able to eat something, and that gradually improved over the day. But we were dealing with that along with Josiah's issues and everything. So Mark and the big girls helped a lot today to do the things that mommy would typically do to help the family. So that was a blessing that they're here to be able to do that. But it's a long road, and dropping the medicine because Josiah reacts so poorly to medicine changes is going to be a long road. This isn't going to be, we're off the medicine overnight, because that causes more seizures for him. Even on other medications, we've seen that the medication's causing a problem as we want to level down. The doctors have leveled us down too fast, and we've had seizures. So we're going to tell the doctors what program we want to go on to do it, because I think that the doctors would probably have us go off it in over a week, like a week's time. And Mark and I really feel like 3 weeks' time is much more. So we're going to write to the doctor and tell her what we're doing. But that's what's going on. Was there more things I was supposed to say in that?
I think speak quickly to the issue of future videos and how we can help other people. Why are we doing videos about this?
So we're doing videos about this because we want to show that even in the midst of these trials, God is still good and God is still sovereign. God has given us Josiah for a reason, and maybe we can't even see that reason right now. But God is growing both Mark and I through this. The things that we have to deal with in the moment are hard to deal with and challenging, and we don't want to be in the midst of it, but we do want God to grow us. We want him to make us more Christ-like. We also want to encourage parents that you know your child best, and if the doctor says, here, we need to do this medicine, and you say, that medicine is not helping my child, stick to your guns and talk to your doctor about what different things you can do. Maybe it's a different medicine, maybe it's a therapy, whatever it is, but your doctor is only with your child 15 minutes a month. I don't know, depending how often you go to your doctor and everything.
Maybe 3 to 5 hours a year.
So stick to your guns. Make sure your doctor is listening to you when you're saying, here's what's going on. Make sure that you're getting help from other people, that other people can see the problem. When we were down in Tennessee, it's easy to try to hide our problems, but our friends that we were staying with, because we chose to sometimes keep Josiah around in the midst of a behavior, they were able to see what these behaviors looked like. And so I hope they realize that it's not just if you just corrected him a little more, it's not that type of issue. Yes, we have to keep him safe, but what?
We have something like, I don't know how many years of parenting experience we have. We're both very experienced with children with special needs, special diets, special medications of varying severities, and we still feel kind of stumped on this one.
So reach out for help. Have people around you that are willing to support you, and if there's people that aren't willing to support you, if there's people willing to say, if you just corrected him better and that type of thing, maybe it's time to take a break from that person. I'm not saying to totally cut off all relations and everything, but that's not the person you need in your home on a regular basis if they're not willing to help in the ways that need to be helped. And I'm not saying that as just listen to the people that are agreeing with you, but there are some people in this world that want to blame a parent for all the child's problems. And when it's dealing with a medical issue like this, a brain issue like this, it's not a parenting issue.
I was just reading an article about a little girl who got a tick bite and got Lyme disease, and all of a sudden went from sounded like Josiah a lot. And I was just thinking about sometimes a medical condition has such severe and immediate consequences that you feel like it's not even your child.
Yes.
I don't know who this kid is. We're not talking about Josiah sometimes has an attitude problem about certain things. We're talking about a radically different personality that's very short term during, maybe it's seizure activity, maybe it's something else, but a radically different person, so to speak, that didn't exist 2 months ago.
Right. And then even before that, from different things that have happened, this is not the child we had even a year ago. And the doctor even said that. So we did a telehealth appointment because we were supposed to go to the doctor last week. Things didn't work out for us to go to the doctor's office, so we did it via computer. And she said, this is not the child that I met a year ago when we started doing our visits, because he's so lethargic and all of that stuff. So anyway, just as a parent, we want to encourage parents to stick to their guns of what they feel is going to help their child. Yes, we need medical help. Yes, we need to talk to doctors and things, but pay attention to what's going on with your child in your own home and tell the doctors what's going on. So I guess that's what we got. The children are getting a little rowdy out there, and I've got to go check the chocolate cake that the kids helped me make for dessert tonight. So just wanted to let you guys know what was going on. If you have any questions, feel free to comment in the video below. I know that I have not responded to any questions on our videos for about a week. It's been a little crazy because of dealing with these behaviors and everything that's going on, but I will try to get to those. If you leave a comment, I will try to respond. I may have to message you because I may not want to put all the information in a comment. So depending who you are, I may give you an answer or I may not. Please do not feel that you can't write to me and me to be open in certain things, but this is also my child who I want to make sure that I protect. So
personal, private, confidential kind of conversations could be had through the Hurting Little Cows to the Glory of God Facebook page.
Yes, I can answer those separately for each person. So what information I feel like giving. So, and you can just keep praying for us. So thank you guys for joining us on Hurting Little Cows to the Glory of God.